Hello everyone, and welcome to another Arthritis Help Movement Improvement session where you learn to move differently so you can feel better. I'm Dr. David Sofer, physical therapist, and today we're going to be talking about managing chronic pain flare-ups. I've been hearing from a lot of you that this is the most difficult thing that you have to deal with. You have pain on a regular basis, but sometimes it just accelerates. It just hits that 10 out of 10 where you can't move and you don't know what to do about it. Today we're going to go through the session that I use to help my patients when they walk through the door in intense pain, can't move, can't function, and how I can back them down off of that serious pain into a place that's at least manageable and workable. It is by no means a cure, but it does give you a tool to give you power to help take down that pain from that biting, can't move, can't do anything, to something where at least you can function and then begin to restore and begin to heal. I like to use breathing as an apparatus to help downregulate pain signals and improve mobility. And as we go through this, we're going to be talking about focusing in on your breath and understanding how breath facilitates movement in the body, and how movement, when we learn how to move in a pain-free way, it helps us to restore function and facilitate healing. For this session, the most important thing is figuring out how you can be in a comfortable position. So what position can you get into that eliminates or at least reduces pain as much as possible? For many of my patients, that's lying on your back with a pillow underneath your head or a bolster underneath your knees. Sometimes the feet are up on a chair or even on a couch as they lie on the floor. For some people, lying on the back is not possible, and lying on the side is their only option. If that's what it is, then that's what you do. If it's lying in the recliner, however you can get into a place where you feel supported and comfortable, that's the place to start. So let's lie down our backs, or whatever position is most comfortable for you, and we'll begin. As you can see, I'm lying here with my head elevated, nice cushion, a bolster underneath my knees. Some people are more comfortable with their feet and standing. Whatever works for you is the position that you should find yourself in. From here, we're just going to take a moment to focus in on our breathing and allow ourselves to inhale and exhale and feel the path of the air as it moves through your nose and mouth, down your windpipe into your lungs, and then out through exhale, through the nose and mouth again. We're just going to get in harmony with the rhythm of the breath. We're going to try to avoid rapid breathing and taking time to really feel, not an exaggerated breath, but the fullness of the air coming in and the fullness of the air exhaling. It's very common for people who are in a lot of pain to hold breath and only breathe at the top of their breath. So there's a lot of air in the lungs, and then there's this mini exhale, and then they can only take short, kind of brief, and then quick breaths. And fast breathing actually increases fight or flight or sympathetic nervous system input in the brain. And so if we can find slower, fuller breaths where we're breathing from a comfortable inhale and then a fairly full exhale, it's a nice way to start. Feel the rhythm of the breath. And feel how much of the air you can exchange with each respiration. Feel your body sinking into the table or the floor or the bed or whatever surface you're on. Feel that your body is heavy and that you're allowing your body to be completely supported by your environment. You're allowing your body to be at ease. If you're feeling that there is a tension somewhere, or if there's a pain somewhere, see if there is a mechanism you can use to bolster an area or support your body so that muscle can feel relaxation. If that's possible, great. If it's not possible, manage as best you can. But really trying to find a way to get yourself to little or no pain is the goal. And sometimes that takes experimentation, kind of playing with different supports or different positions. It's not always intuitive. Allow your body to sink into the surface. Feel how your body contacts the surface. Allow yourself to melt into the ground. You're going to take the hands, and we're just going to gently place them on the low ribs. And you're going to feel that as you breathe, that movement occurs at the ribs. When you breathe in, the ribs move up toward the ceiling, if you're lying on your back, and out toward the sides. So there's this up and out position that occurs with each inhalation. And then with the exhalation, you want to feel how the ribs move in the equal and opposite direction, so kind of down and back and in. I want you to continue to breathe, feeling that movement of the ribs, and noticing the pattern of that up and out and down and in, and making sure that you are not putting up any roadblocks or any obstacles to that ability of the ribs to move in that direction. An obstacle or roadblock is usually going to come in the form of muscle tension, and that's usually protective in nature, that when we're hurting we like to lock things up and hold. But that protection sometimes facilitates more pain. It becomes a fulfilling cycle. We need to break that cycle, and a nice place to start is with these ribs. Feel the freedom and ease with which the ribs can rise when you breathe in, and the freedom and ease with which they can fall as you breathe out. And your hands are just monitoring the movement in order to make the movement clearer in your mind's eye. I want you to move one hand down a little bit, just onto the center of your abdomen. I want you to feel as you breathe in, how the abdomen rises and fills with air at the same time as the ribs rise and open. And then the abdomen falls as the ribs fall. Feel this pattern of breathing in and filling the abdomen with air, and breathing out and letting that air leave your lung cavities. Breath in fills the balloons. Breath out deflates the balloon. Feel the abdomen rise and fall as the ribs rise and fall harmoniously together. I want you to take the hand that's on the rib and you're going to move it onto your chest, onto your breastbone. And again, when you breathe in, you're going to feel that abdomen rise. And you're going to feel the chest also rise up, not quite as much up, and then tilts a little bit towards your chin. And when you breathe out, the belly drops and the chest drops. And feel that idea of the belly and chest both rising up and maybe tipping a little bit away from each other. And then as you breathe out, they both come down and maybe tip toward each other a little bit. If these movements are clear to you, that's great. If these movements are obscure or you can't really feel what I'm saying, that's okay. Just focus on the breath, listen to the words, and the awareness comes with time and practice. Breathe in, feel the rise of the belly and the chest. Breathe out, feel the fall of the belly and the chest. Take a few minutes to appreciate the fullness of the breath. Notice that the breathing rate may have slowed a little bit already from where you started. Excellent. From here we're going to put the hands back on the ribs. Actually, we're going to put the thumbs on the ribs this time and let the fingertips rest on the belly so you can get a sense of both the ribs and the belly at the same time. When you breathe in and you feel the ribs rise and you feel the belly rise, I want you to notice that your spine, your low back, actually rises off of the surface. And then when you breathe out, as the belly falls and the ribs fall, that the low back falls down and into the surface. That every breath allows a bit of an undulation of the low spine, and that it's able to lift a little bit and fall a little bit. Every breath is a mini mobilizer of the spine if we allow it to be. If you feel no movement in your spine, then you're tensing something, either your abdomen or your low back muscles, preventing movement. Try to free the abdomen and free the ribs and allow that low back to rise with the inhalation and fall with the exhalation. Take a few respirations to practice that movement. Feel the heaviness of the rest of your body into the surface. Feel how your legs fall into the floor or into the bolster. Sometimes you'll notice little hidden points of tension that you can slowly let go of as you go along the way. Feel the rise of the back with the inhale and the fall of that low back with the exhale. Excellent. We're going to bring the attention up now into the mid-back. So on the mid-back, there's generally one point that takes a little bit more pressure than the rest of the mid-back. And notice that point as you just lay peacefully, comfortably. And notice with the breath in, that point actually travels up. So the area of the back that takes pressure of the upper back kind of goes up toward the neck. And then as you breathe out, it falls down towards the hips. Notice that pattern, focusing on the pressure in the middle of your mid-back, that with the breath in, the pressure changes, shifts up towards the neck, and with the breath out, it falls towards the hips. So feel that each breath is actually a rolling, a little miniature rolling of your upper back pressure into the floor. That it rolls backwards a little bit towards your neck as you breathe in, and roots forwards a little bit towards your pelvis as you breathe out. Take a few breaths to appreciate that movement. Breathe in, feel the abdomen rise. Feel the ribs rise, feel the upper back roll backwards, and then breathe out, feel the chest fall, feel the ribs fall, feel the abdomen fall, feel that upper back tilt downward towards the pelvis. That every breath is also a mobilizer of the upper back. So now we've kind of embraced comfortable, peaceful, and unrestricted, unencumbered breathing, and feeling how your breath mobilizes your ribs, it mobilizes your abdomen, it mobilizes your low back, and it mobilizes your upper back. And feel that every single respiration is moving in waves your whole spine and your whole rib cage and your whole abdomen. You might notice that this movement actually travels even further into your neck and head. That when you breathe in, the chest rises and the chin falls down a little bit towards your chest. And when you breathe out, the chin rises and the space behind your neck actually rises a little bit as well. When you breathe in, the chin falls. It's almost as though you're looking down towards your toes. And then when you breathe out, the chin rises. It's almost as though you're looking up overhead, over your eyebrows. And you can even allow your eyeballs to move in harmony with that pattern. Inhale and look down just with your eyeballs and feel that your chin kind of tilts down a little bit as well. And exhale, feel that your eyeballs look up overhead and your chin rises up. And see if you can connect that movement of breath and vision. Breathing in, allowing your eyes to look down towards your toes. Breathing out, allowing your eyes to look up overhead. Breathing in, feeling the pressure tilt up towards your neck a little bit. Breathing out, feeling the pressure tilt down towards the pelvis a little bit. Breathing in, feeling the ribs expand up and out. Breathing out, feeling the ribs contract down and in. Breathe in, feeling the abdomen rise to the ceiling. Breathe out, feeling the abdomen fall toward the floor. Breathing in, feeling the low back rise from the table. Breathe out, feel it fall. And we could extrapolate this movement from the top of the head all the way down to the pelvis, knees, and even feet if we were able to be loose enough and aware enough in our movements. I'm not going to talk you through that entire journey from head to feet today, but it's something that you can explore on your own if you feel that you have the time and inclination and interest to do so. We're going to take, instead of going from this granular view, we're going to take a more expansive view again and just feel how the whole body feels open and inflates with the breath in, and feel how it falls and empties with the breath out. Feel how each respiration facilitates a feeling of peace and ease and comfort and mobility and freedom in your body. Every breath is movement. Every breath is life. Feel your ability to breathe and move, for your body to be heavy into the surface. Excellent. Slowly you're going to bend one knee, so you're standing your foot onto the floor. You're going to take out any bolster that's underneath your legs if you have it. You're going to allow yourself, using your right foot or the foot that's standing on the floor, to roll your body to the side. And take a moment to lie down on your side. Feel the softness of the breath. Transitions from movements when you're in a lot of pain can be very difficult, very challenging. Take time and allow your body to move smoothly, and allow the surface to support you instead of you supporting yourself. From that point, you're going to take your top hand, you're going to push into the surface, and then your bottom elbow to bring yourself up to sitting. Again, those transitions being the most challenging part when we're in a lot of pain. That entire breathing pattern, while we're focused on lying down, is there when you're sitting up and when you're moving and when you're walking about. So if you find yourself in a scenario where you can't lie down, you can't get into that position, you can still focus on the breath. And you can still take a moment for yourself and still find that calm and that ease. Go back to the breath and allow it to facilitate movement. Allow it to facilitate your parasympathetic nervous system, which allows for resting and comfort. This is by no means a cure to chronic pain. It is just a tool to help you manage those most painful flare-ups that you have. And even when you don't have the flare-ups, this is a nice way to reduce stress, anxiety, or just find comfort with movement or laying. Thank you so much for joining me this week, and really thank yourself for taking the time and the energy to do something good for you. It is not easy. It is worthy of your appreciation, that self-love, that you have the patience and the ambition to take the time to take care of yourself. I'll be back next week with a whole new video teaching you how to move a little bit differently so you can feel better. I'm Dr. David Sofer, physical therapist. I'll see you next week.